Dr. Henry, can you tell us what is a stroke and what cause for the stroke and how we can prevent? And also in the mainstream, right now, what kind of treatment among the Western doctors, and what is the benefit for taking the Fountain Life? What's different from the traditional method and how it can help. If you can have other testimonies, I would love to hear. So can you tell us about it?
Stroke happens in the brain. So any blood vessel damage in the brain, whether it's a blockage or bleeding, they are all related to this stroke category. So stroke happens because of different reasons. It could be trauma damage, or it could be accident to the blood vessels. It could be because of blood quality. Usually, when the cholesterol level too high or triglycerides level too high, or whether there is some other issues, or it could be in an airplane for too long hours of flight. So there are many factors that can happen. Some people they expose themselves to the extreme cold weather while their body is not in good shape. So there are so many things that could happen that can cause a stroke. The traditional way of treating stroke, it involves the surgery to take out the blood clots or blood plaques in the brain, or they could be trying to use blood thinners, to use aspirin, use different medication to make the blood flow better and to try to help the body to recover from stroke. Um, but usually the result could be limited. So we have to deal with the root cause of the problem. We need to improve the blood quality. Sometimes we need to increase the blood quantity. Some people they don't have enough blood to circulate in the body, so the body is gets stuck, or the blood cannot flow well to the brain. That can cause a stroke as well. And some people they have this plaque in different parts of the body that can flow to the brain and cause a stroke. So all these can cause it, but if they resort to natural sources like the Fountain of Life, they can actually improve the blood quality, blood quantity, the organ function like the kidney and liver or the heart, so that they have better performance in the body in general, and then they can help to fight off, or they can prevent the body getting into a stroke situation like that. So, yeah, that's what I can tell you for now.
Okay. Any testimony you want to share with us?
Yeah, we do have people that had a stroke, and they just rub it topically on the brain, on the side of the brain that's been affected, or they rub it on the side of the body that been affected. But taking it orally inside would be really helpful. So we have people that had a stroke, and they just apply it and take it. And in a few days, they got better. They got out of the ICU. They got out of bed, and they eventually, after half a year, they were able to drive a car for the chores. So that's the testimony that I had.
Great. Thank you very much, Dr. Henry. I let you go.
Okay, thank you.
Good
Have a
night.
good night.
Okay,
Yeah,
goodbye.
bye.